This is Susan DiSanto doing her C349 physical health assessment. Good morning. May I ask your name?
My name is April Gans.
April, can you please tell me your date of birth?
January 9th, 1976.
And can you please tell me what today is?
Today is Sunday, September 20th, 2015.
Thank you so much. Can you tell me why you're here today?
I'm just here for my annual exam.
Okay, well thank you very much. Well then, first thing I'm going to do is I'm going to go ahead and get your vital signs. I'm going to take your temperature. Under your tongue, please hold it there until it beeps. Thank you. Okay. Temperature is 97.9. Thank you. All right. I'm just going to have you rest your arm right here on the bed. Blood pressure is 112/74. Pulse is 76 and regular. Okay. Have you been having any health problems?
No.
Okay. Are you on any medications?
No.
Do you have any allergies to medications?
No.
Any food allergies?
No.
No. Okay, wonderful. Okay, well, what I'm going to begin with is just a general skin assessment. Check you for any skin rashes. Have you noticed any discolorations or rashes or sores on your body?
I have not.
Okay. All right, well, doing just a general skin assessment. Skin is warm. Okay. I see no abrasions, no rashes, no open wounds. Okay. Go ahead and check your scalp. Okay. Checking your bony structure. I don't feel any abnormalities. Okay. Hair is thick and no dryness to the hair. Okay. Okay. I'm going to check just your skin turgor. So let me take a look at your hands. I'm going to have you rested. Quick response to the skin turgor on the left hand and to the right. Capillary refill is brisk bilaterally. Okay. Continue your examination. Have you had any complaints of headaches, dizziness?
No.
Any blurred vision, double vision, any visual changes?
No.
Okay. Well, in front of you I have something called the Snellen chart. What I'd like you to do first with both eyes open is read the line that you can read the clearest.
Okay, the lowest line that I can clearly read is line number 8, and that's KUPSATTHE.
Okay. Can you please cover one eye? Read it again
Yes.
with one eye closed.
KUPSATTHE.
Correct. Can you cover the other eye?
KUPSATTHE.
Thank you so much. That's perfect. Okay. I'm just going to press on your sinuses here. So any pressure when I press?
No.
Any drainage, discharge?
No.
No. Okay. All right. I'm going to take a look at your conjunctiva. It's nice and pink. All right. I want you to pick a spot on the wall, and I'm just going to check your corneal reflexes.
All right.
Okay. Just look straight. Good. Keep looking straight. Good. Excellent. 3+ and brisk. Okay. Going to take a look at your nose now. I would use an ophthalmoscope to really look in the back of your eye, but I don't have one. Okay. Now I'm just going to do a quick examination of your nose, so that I'm going to put the scope up in your nasal passage. Okay. Okay. Mucosa is pink and moist, but I don't see any drainage or discharge. Any drainage or discharge from your
No.
nose lately? Okay, fine. Okay. All right. Now I'm going to do an examination of your ears. Have you had any drainage, pain, ringing in your ears lately?
No.
No. Wonderful. Okay. All right, I'm going to pull a little bit on it. Does that hurt at all when I pull down on your ear?
No.
Okay. This is an otoscope. I'm going to go look in your ears. I'm going to check your ear canal and the inner structures of the ear.
Okay.
Okay. Looks nice and pink. I don't see any damage to the eardrum. Come to the other side. Okay. Good. No discharge, drainage, and no damage to the eardrum. Okay. Thank you very much. Okay, now I'm going to examine your mouth. I want to check your dentition. Have you been to the dentist lately?
Yes.
Good. Okay. So can you take and open your mouth? Okay. Mucosa is pink and moist. I don't see any dental damage. Okay. All right. Now, what I want you to do is open and close your mouth. I'm just checking your TMJ, your temporal mandibular joint. Any pain with that?
No.
No. Good. Okay. Now, any bleeding gums? Any dry throat? Any hoarseness?
No.
Wonderful. Okay, thank you. Okay, I'm just going to check your cervical lymph nodes. What I want you to do is take a swallow. One more time. Okay, don't feel any abnormalities or masses. That is very good. Okay, so now we're going to do some of the cranial nerve testing. That's different nerves in your face. So we're going to check cranial nerve number 7. So I want you to smile. Okay, and frown. Good. Everything is symmetrical, bilaterally. Okay. Can you move your jaw side to side like this? Okay. Equal. That's cranial nerve number 5. Now let's check cranial nerves 2, 3, 4, and 6. That is your ocular, optic, trochlear, and abducens. Okay. So what I want you to do is keep your eyes on my finger. And I want you to follow it in the direction it goes. Keep your head still for me. And just follow my finger. Very good. Excellent. All right. Now, okay. So cranial nerves number 9 and 10 are your glossopharyngeal and your vagus. Okay, I've already done the examination of your mouth and your mucosa. So what I want you to do is I want you to stick out your mouth and say ah.
Ah.
Stick your tongue out. Say ah again.
Ah.
Okay, gag reflex is intact. Okay. All right. Now, for cranial nerve number 12, I want you to stick your tongue out and move it side to side, as such. Perfect. Symmetrical. Okay, so cranial nerve number 7. What I want you to do is raise your eyebrows up and down, up and down. Perfect. Okay, can you puff out your cheeks and let it out? One more time. Perfect. Thank you. Okay, now your olfactory is your cranial nerve number 1. Have you had any issues with smell?
No.
Okay. What I want you to do is take your finger and close one nostril, and I want you to breathe in and out through one nostril. Any difficulties with that?
No.
Okay, how about the other side? Fine. Now, if I had some different scents and stuff, I would test that. Okay? Okay. Now, I'm going to check your cranial nerve number 5, which is your trigeminal. So what I want you to do is close your eyes, and you're going to feel a light touch, and I want you to tell me on the right or left side of your face where you feel it.
Left side. Right side. Left side. Left side.
Perfect. Thank you so much. Okay. All right. All right, now we're going to check cranial nerve number 8, which is your vestibulocochlear. So what I want you to do is cover your one ear, and I'm going to whisper something to you over on this side, and I want you to repeat it.
Apple.
Okay, this side.
Orange.
Perfect, it's intact. Okay. All right, so that's it for the head. So now I'm going to move down and start palpating and checking you for any masses in your neck and shoulders. Okay. All right, everything is soft and tender. Any pain when I press down?
No.
Okay. All right. So I'm going to check your carotid arteries. I'm going to take a listen to them, see if I hear anything. Okay. Okay. All right, carotid arteries are strong and palpable bilateral. No thrills or bruise. I want you to shrug your shoulders up and down. That's cranial nerve number 11. Okay, they are symmetrical. All right, I just want to do a little range of motion testing with you. So I want you to move your head, keeping your shoulders still, side to side. Side to side, side to side. Then chin down and back as far as you can. Okay, good range of motion, no stiffness or soreness?
No.
Okay. All right. Okay, now what I want you to do, I want you to put your arms up, hands flat out, and I'm going to press down on your hands, and I want you to fight me. Don't let me push your hands down. Good, and I'm going to come underneath, press down. Excellent strength bilaterally. Okay. Okay, stop. Okay, so now I'm going to move into listening to your lungs and your heart. So just breathe normal. Okay. Heart sounds are good. S1, S2 is normal. And I hear no murmurs. Okay, so I'm going to come around your backside and I'm going to listen to your lungs. Okay. I want you to take some nice slow deep breaths through your mouth, in and out. Okay. Now, what I want you to do is say the number 99.
99. 99. 99. 99.
Thank you so much. Okay. Lungs are clear to auscultation. Have you had any cough? Any productive sputum or anything lately?
No.
No. Any fevers, chills, sweats?
No.
Wonderful. Thank you. Okay. Okay. Would you mind laying on the bed for me? I'm going to continue your physical exam. Okay. Have you lay down flat. Okay. Go ahead. So what I want to do is check your jugular veins. Okay. So lay down flat. Can you look to your left? Okay. I'm just going to palpate them. Okay. There's no jugular vein distension on the right side. Can you look to your right shoulder? Very good. Thank you. No jugular vein distension on the left side. Okay. So I'm going to listen to your stomach and listen to your bowel sounds. Just breathe normal. Okay, bowel sounds are positive in all 4 quadrants. I'm just going to palpate here. Is there any pain when I palpate?
No.
Okay. All right. Don't feel any masses. Okay. Okay. Percussion is good. All right. I'm just going to feel some of the structures in your abdomen, like your liver and your pancreas. Liver is defiant. Kind of push in your side here to feel your kidneys. Okay. Any pain when I do that?
No.
All right. Any changes in your bowel or bladder habits? Have any issues?
No, it's been regular.
When regular. Okay, great. Thank you. Stop. Okay, I'm just going to take another listen to your abdomen, but I'm actually listening to the flow through the arteries that go through your abdomen, which is your aorta, your inguinal, and your femoral. Positive flow through all arteries, no thrill or bruit. Okay. All right, so now we're going to move to your lower extremities. Okay. Lower extremities are warm and dry to the touch. No noticeable sores, abrasions, or wounds. Okay. Do you feel me touching you both bilaterally here?
Yes.
Okay. I'm just going to check your pulses. So I'm going to check your popliteal, which is behind your knee, so just rest comfortably. Okay, positive pulses, bilateral popliteal. Okay. Positive tibial. And positive pedal bilaterally. No notation of any swelling. Hair growth is normal, so no evidence of peripheral artery or vascular disease. All right. So why don't we just do some testing of your strengths? Okay, can you raise your left leg straight up off the bed and down? And your right leg straight up, straight down. Okay. So as I did with your hands, I'm going to press against your foot. All right, I want you to try and raise your leg, press against my foot. Good, nice and strong. And same with the right side. Good, nice and strong. Okay. Now I'm going to do something called the Babinski test. So, I want you to just relax your foot. Are you ticklish? Okay.
Yes.
All right. Okay. So we have positive pressure.
Sorry.
Stop it. Okay, going to continue to check your range of motion. Can you lay on one of your sides for me, please? Doesn't matter because we're going to do both. Okay. I want your legs out straight. Okay. And then, can you raise your right leg up? Keep it straight and back down. Very good. Okay, can you roll to your right side and let's do the left leg. All right. All right, keep your legs straight and lift your leg up and back down. Any pain with that in your
No.
hips or legs anywhere? Very good.
No.
Okay, let's go ahead and I'm going to have you sit up. Okay, come on to the side. Now, when you're walking, are you having any pain? That's
No.
called claudication. Sometimes people may have blood clots. When they're walking, they have pain down their legs. So no pain, any numbness or tingling in your feet.
No.
Okay, good. All right, so the next thing I want to do is check your reflexes. Okay, so I'm going to have you rest your arms comfortably. Okay. All right, so what I'm going to use is the bell of my stethoscope. Okay, so I'm going to check your triceps. So I'm going to rest it comfortably. Good positive reflex. Good, check your bicep. Good positive reflex. And I'm going to check your radial. And we'll watch for twitching in the thumb. Very good. All right, so I'm going to come over and do the other side. Okay, once again, checking your tricep. Good positive reflex. The bicep. Positive reflex. I'm going to have you turn your hand over. Or do your radial. Positive reflexes. All right, now I'm just going to check your reflexes in your leg. So I'm going to be tapping right below your kneecap. Okay. Okay, positive reflexes in both legs. All right. Now, as far as any female issues, any problems with your menstrual cycle?
No.
No? Are you on birth control?
No, my
No.
husband has had a vasectomy.
Okay, so normal regular periods, nothing too heavy?
Yes.
Any problems with cramping or anything?
No.
No. Any discharge?
No.
All right, thank you. Okay, I'm going to have you stand up for me. All right, so now what I want you to do is put your arms straight out. And I want you to close your eyes. And I just want you to stand there and hold. Okay, this is called the Romberg test. And I don't see any sway or changes from center. Thank you very much. Go ahead and close your eyes. Okay. Go ahead and have a seat. All right. Okay, so just wanting to check any issues with like your thyroid or anything. Have you noticed any issues with changes in temperature, not tolerating heat or cold?
No.
Okay. All right, so I just want to palpate your thyroid. Okay. No masses or nodules. Okay, so this is a test for extinction. So what I want you to do is, I've got this pin. I'm going to be either testing you with the sharp side or the dull side. So I want you to tell me what you feel, and I want you to close your eyes. So if you can close your eyes for me. I want you to tell me if you feel sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp.
Okay, perfect. Go ahead and open your eyes. Thank you so much. Okay, next thing is the cerebellar test. So what I want you to do is I'm going to hold my finger out. I want you to track it, and I want you to go back and forth from my finger to your nose, and I'm going to be moving it. So whenever you're ready, touch my finger first, then touch your nose. Good. Perfect. Wonderful. Okay, if you could, please stand up. Okay, what I want you to do is I want you to walk to the wall. I want you to walk heel, toe, heel, toe. Gait is steady. Okay, now I want you to turn back and only walk on your heels. Good. Any pain with that?
No.
Wonderful. Okay, have a seat. Stop. Okay, now what I want to do is have you stand up, and I want you to face the wall. Okay. And what I'm doing is checking your spinal column. So I'm just palpating. Okay. That's okay. Can you bend over, please? Okay. So spine looks straight. I feel no bony abnormalities. S curve is intact. I don't see any evidence of scoliosis. Any pain in your back?
No.
Okay, go ahead and stand on up. Stop. Okay, so that actually is the end of the physical exam. I did want to review just a few things with you. So, have you had any issues with getting dizzy, any syncope, any weakness on either side of your body?
No.
Any difficulties swallowing foods or fluids?
No.
Okay. Notice any like involuntary movements or spasms?
No.
Any seizures?
No.
Okay. How about any problems with bleeding? Notice that you bleed more extensively than normal?
No.
Okay. Any history of anemia or low blood count?
No.
Okay. And then how have you been as far as emotionally? Any problems with depression or anxiety?
No.
Any undue stress at work or at home?
I mean, no more than everyone else. No.
Understood. Thank you so much for sharing. Is there anything that I can help with you today? Anything that you feel that is something we need to review?
No, I feel like you've done a pretty thorough exam, and
Well, I appreciate your
nothing else
time.
I can think of.
Okay. Well, if there's nothing else, that completes our exam.
All right. Thank you so much.
Thank you.
Bye.